So we have another risk factor question. Which of the following is the most significant modifiable risk factor for this patient developing atherosclerotic cardiovascular disease? So in this type of question, we need to pay attention to the modifiable risk factor. Modifiable risk factor, we have to rule out anything that we cannot change. So reading over the options, we see A and E. So A, family history of premature cardiovascular disease. It's not modifiable, so we ruled that out. And then E, age over 65. Age is not a modifiable risk factor, so we ruled that out. So we're left with B, C, and D. So let's go ahead and look at our question. A 66-year-old man, he presents to the clinic for routine health check. So it's like annual exam. He has a 40-pack year smoking history and drinks alcohol socially. He has sedentary lifestyle, BMI of 28, and his father died of myocardial infarction at the age of 58. He takes no medication and has no current symptoms and complaints. Vitals are normal. So we go ahead and see which is the most significant modifiable risk factor, and that will be cigarette smoking. So cigarette smoking is the most modifiable risk factor in atherosclerotic cardiovascular disease, and quitting leads to a substantial reduction in risk over time. Overweight, BMI is mildly increases the risk, but it's not as strong, as well as sedentary lifestyle. So D is our option, and that's our answer. If you like my content, please subscribe, and I'll be making more videos. Thank you.